my name is Rich Clark, the Guide to the Right Path, and within this I'm a hypnotherapist, a CBT practitioner and a psychotherapist. Now, I've mentioned about anxiety in 2 posts previously, about what is anxiety and the different types. Then I've explained about the therapy techniques I would use to help you with that, but I'm going to give you a case studies and just an example of one of how I help someone with anxiety. So within this, I've worked with at least 50 clients aged between 30 and 50 years old, all presented with generalised anxiety disorder. There is actually more, but I would said there are some more of them go into PTSD and so forth. So I said this would be more the generalised one. Manifesting as a constant worry about family, work and health. And the physical symptoms included insomnia, bad sleeping patterns, muscle tension and panic attacks or anxiety attacks as well. So it is usually recommended in the field of psychotherapy combined with CBT and hypnotherapy methods over 12 weeks or sessions, resulting in a 60% reduction in anxiety symptoms. Now, with my work, the same issues with my ARC program, which I do, will be reduced in 3 to 6 weeks, so each session being 1 to 2 hours, so half the time and more effective results. And with cases that are more extreme and branch out into other issues too, it can stretch to the Life Empowerment Coaching Program, which is up to 8 sessions, but these are not as common with this symptom. So the one issue with people with anxiety is they can be worried about letting people down, and that would be a constant worry of commitment. So what I will say is with my case studies and how I work with them is that most clients is we find out, we would do timeline therapy for the past in most starting sessions. And that will be found out in the discovery call, what caused that, what the anxiety is. Then within that, we would then go to the first time that person has experienced that anxiety condition. And if there is more than 1 or 2 free forms of that anxiety, then we can do that with more sessions or try and get as much done as we can in one. Then what we would do is once we've changed that, how they react to that, and how then they feel as an adult as they've got more control over that or the situation, then they would then go to the next session, which would then actually create and help them to work towards living a life with no anxiety, and then how that's going to progress them forward and then to a future where they have removed that issue and see how it helps them develop into the person they really want to be without this condition. Also, if you do want to know more details about how to control anxiety, there is clips, but there's also a video of how to control anxiety I have on my YouTube channel, and that is also teaching breathing techniques of pranayama and breath work, which actually helps control anxiety, and these can be added or used, but also even if you do a discovery call, I will teach you 1 or 2 techniques, basics, to help you even if you decide you don't want to work with me as a therapist. So until next time, I shall speak to you soon.